All right. Welcome everyone to LVHA's first virtual meeting. My name is Linda Richardson, President of LVHA, and on behalf of the LVHA Board of Directors, I would like to thank all of you for your support by participating today. Our event sold out in 3 days, which is amazing, so thank you, thank you. I'd like to give a shout out to a couple of folks on the board that worked on putting this together. Mr. Zach Lucific, I did practice Zach from Park MGM, and Linda Ness from Evolution Event Services. Great job, you guys. Just a quick housekeeping note to let you know that the LVHA board is working on a revised 2020 plan. Our creative juices have been flowing, and we'll be sending out a newsletter soon to provide you with updates on programs and events. Amid these unprecedented times, we must continue to stick together, help each other, and stay safe. As the state of Nevada and our leaders in our hospitality community put together plans to reopen Las Vegas, hopefully in the next several weeks, we'll be sending out a newsletter soon. Amid the unprecedented times, we must continue to stick together, help each other, and stay safe. As the state of Nevada and our leaders in the hospitality community put together plans to reopen Las Vegas, hopefully in the next several weeks, we are so thankful that our friend Michael Dominguez accepted LVHA's invitations to speak to us all today. So without further ado, Michael Dominguez currently serves as the President and CEO for Associated Luxury Hotels International, which we all know as ALHI. Prior to joining ALHI, Michael served as Chief Sales Officer at MGM Resorts in Las Vegas, and has held leadership positions with Lowe's Hotels, Hyatt Hotels, Starwood Hotels, and many more. Michael speaks in the hospitality industry often on topics of disruption, the state of the industry, the economy, and has been recognized in Meetings and Conventions Magazine survey as a top industry speaker. At this time, I'll turn the event over. And again, thank you, Michael, for spending time with LVHA today.
It is truly my pleasure, and thanks for the invite, and thanks for the reach out, Zach. Always happy to be with the Las Vegas family, and yeah, you guys are still home. So I will go through a little bit. I'm going to move rapid fire through what we are seeing and what we know, and that way we have plenty of time for Q&A. And give me 2 secs just to share my screen, and I will go through an update and presentation. I do a similar kind of update with our team, much smaller in nature. And then we have been having planner calls as well on a weekly basis. And I do have some good insight in what we're hearing from the planner community, as well as what some of the hotels are doing and some of the industry work that's going on. So I will get started. And one of the things I continuously try to stress is that it's important to put the pandemic we're dealing with at the moment into context. And what I mean by that is I always focus on the active cases. You're going to keep hearing about the total case count, which is always going to be larger because it will not include those that have recovered. So I focus on active because that's what we're dealing with. And globally, as you can see, we're sitting at 1.9 million active cases, 1.8 million in the mild condition, and it's steady at 97%. This has not changed. It's actually changed for the better, but it's been sitting at 97% for some time now. And the reason that is an important statistic, what is classified as mild condition means that somebody is infected with COVID-19 but won't require hospitalization. So you can see out of almost 2 million cases, they're looking at 56,000 globally that are not in that category. If you look at the total case count, and again, that count will always get bigger. That's why I start with active, but you can see we have 3 million cases around the globe, 212,000 deaths, and 934,000 that have fully recovered. We do have some real positive trend lines, and this is a chart of new cases from Johns Hopkins, and it shows you new cases globally. And what you can see is that we are definitely on the other side of this, and we hope that continues. I think it will, because Europe and the US are the 2 largest contributors, and those 2 areas are starting on the downside of their curves. So I think you're going to see that continue along that trend line. One of the things I've continued to emphasize, it's important to look at this entire pandemic in context. And when you look at this, for instance, this is looking at Europe and Europe's outbreak, and you can see Europe being at 1.3 million total cases and 123,000 deaths. Europe is almost 40% of all cases, was at 1.50%, and most importantly, it's about 60% of all deaths that are experienced around the globe. The other thing I would point out is that Europe is about a month ahead of the United States as far as where they are in their curve and the epidemic. And what you'll see here is that Europe is at 24,000 new cases daily, very much behaving like the United States. And again, they should be much further ahead. Right now, the problem in Europe is France still has a significant daily spike, but most importantly, the UK has shot up the top 5 very quickly. About 2 weeks ago, the UK was barely being recognized on this chart, and you can see now at 157,000 cases, they'll be number 4 by tomorrow. And most importantly, the number of deaths they've seen in the UK has been dramatic and fast because, again, they're a top 4, and it's only been in the last few weeks that has actually transpired. There's a lot of noise in that number, and I'll explain as we go a little bit further, because as you can see, Germany, with a similar number of cases, Germany's death count looks very, very different. And again, we'll get into a little more information there. South America, as you go around the globe, the hotspot is definitely Brazil. Brazil has been growing at about 3,000 cases per day. So a very large spike there. Peru is coming up, but not anything of note. And then Ecuador and Chile, not much there, but as you can see, those are the top 4. When you get to Asia, it's definitely Turkey is the conversation with 112,000 cases and 2,000 cases daily. They've been sitting in that 2,000 case daily spot for about the last week or so. And then when you look at India and Saudi Arabia, decent numbers on the new case side, but India with its population has been very, very small. When you look at 29,000 cases and then only 1,500 cases per day that are growing. Africa, it's South Africa, Egypt, and Morocco are in the 4,000s, but this has been consistent, a couple of hundred cases a day, nothing really to stand out as a trend line. And then when we get to North America, you can see it's the US and Canada. Canada is almost purely isolated at the beginning to nursing home and long-term care facilities. And I'll explain that a little bit more in the presentation. In the US, we're at 1 million cases and 56,000 deaths, 139,000 recovered. But this is probably the most important message that I keep trying to share is we really do have some differences across the country on what this is playing out as. And it's an important one because, as you can see with New York and New Jersey consistently have led the country in new cases, even though they again are much further along. You can see of the total death count in the US, they're almost 50% of that. And the important part is when you look at New York and New Jersey, New York specifically, to put it into context, the state of New York has more cases than any country in the world. So it has become the epicenter. There is a real reality in New York and New Jersey, but that reality is very different than other parts of the United States. And I think this is important because from a media coverage standpoint, what we all saw, because New York is also a central point for communication and media, what we all saw was what was happening in New York, where you saw field hospitals and we saw the military coming in, and realized that although the reality in New York, no other states outside of that Northeast corridor are behaving the same way. And when I say behaving, I just strictly mean as the numbers and how the numbers are coming in. But you can see New York and New Jersey. New Jersey right now is the hotspot. New York is coming down on the other side of this. Massachusetts and Illinois are definitely hotspots, as well as Pennsylvania. But California, even though it's high on the list, not a hotspot, and I will show you why as we move through this. But in the US, what's really positive is we are on the other side of the curve as well. And it's interesting that our curve line looks very much like the global curve line. So when you saw that spike, we were spiking. As we start to come down, so does the world case count. So again, with the United States and Europe, hopefully coming down the other side here, you'll continue to see these same trend lines globally. This has probably been one of the more impactful charts that I have been referencing recently. This is from Johns Hopkins. And what they've done is taken a hard look at county by county. And the reason this is so important, the deeper the red and where you almost see purple, the higher the concentration or density of positive cases. And when you look at this, if you're in the beige, there is literally less than 25 cases per 100,000 residents. You can see there's large parts of the country that literally have no outbreak. And you can look in large populous states like California, Texas, and Florida. And with their population, their cases to population, you don't see that kind of outbreak. So it's an important one because you're now seeing the country start to open up in different phases. 8 states yesterday announced that they are starting to open up commerce. And the reason is it is a real different situation depending on where you are in the United States. The other message here too is when you start looking at the rates, and these are confirmed rates of cases in a percentile, this is really what they're looking at. So try not to get stuck on the aggregate number. It's not the aggregate number. It is a percentage of total cases and cases as far as to a percentage of testing. It would be kind of obvious if you're testing more, you're going to have more positives, but there's a percentage and mathematical equation to know where was your baseline. And if you're up 10% in testing and you're only up 3% in positives, that's a positive trend line, even though you're up 3%. So it's a little more complicated, but this actually just shows you the line visually. And you can see in Europe specifically and in the United States, we're on a downward trend. And that's the trend line we really want. The only one not in a downward trend was the UK. When we start talking about, and I'm going to get into how deaths have been registered around the disease, just wanted to point out again, just as a visual, when you look at the death count, and this was as of the 20th, so it has gotten higher, but the percentage or the contribution to the total death count from New York City versus the rest of the United States. And if you put New York and New Jersey there, it even gets higher. And just, again, an emphasis that it looks a little bit different around the U.S. These are your daily deaths, and realize that the death count is very much a lagging indicator. You can see that we're on the downside of this. Also know that there is great debate going on how these some of these are being classified. That's why you see some spikes where you really haven't heard about a spike in it. It has to do with states looking at probable cases, not confirmed cases, and there's a little bit of noise in the math right now. But the only thing we should be paying attention to is the trend line, and the trend line is decreasing, and the trend line continues to decrease, which is what you would want. When I mention about Europe versus North America, when you look at total confirmed deaths, you can see the dominance of Europe versus North America in that total count. And then when you look at daily deaths, and again, realize that Europe is much further ahead of us as far as where they are in their curve, you can see still Europe's contribution to the total death count around COVID-19 is quite large. The model that we have been paying a lot of attention to has been with a model that was actually put in play by Chris Murray, and it's IHME, and it's a health measurement institute, and they have been the most accurate. And just wanted to point out that this was the model that Dr. Birx has referenced often. This is the model when it was first modeled, actually showed the total fatality count being at about 87,000, which was much less than what you heard the media reporting of up to 240,000 deaths. This was the model that actually had the info. What's been nice is this model has gradually been revised. As you can see, we've missed their modeling daily, and we missed it again yesterday, which is a real positive. And what's important is we keep missing it, and it means the total modeling is going down. This chart has gone from 93,000 to start. It's sitting at 67,000 as far as an estimated total fatality count. You hear a lot about testing. We know we have to test more to be able to get moving. And just want to point out, we're at 5.5 million tests in the United States, and this percentage is growing. We're 83% of all tests now are coming back negative. So we're testing more, but not necessarily seeing a lot more positives. And this chart is a great visual that when you look at this chart, it shows you the gray area that you see is the amount of testing as a ratio. The brown is a percentage of positive tests. And what you'll see is that the gray in these states has continued to grow, while as a percentage, the brown has remained steady or shrunk. You can even see in New York, originally with New York, you almost saw no gray. The band of gray with New York is growing, which means they're testing a lot more, and now the positives are slowing down. But what's really important when you look at this visually is California, Texas, and Florida, three of the more populous states, have a very different reality than what we're seeing in the Northeast. And that's really a positive for our economy and our recovery and what we need. When you look at it as pure numerics, you can see that this is in order of positive cases. And you can see that New York is definitely leading, and as well as New Jersey. But it's important to point out, if you look at something like California, California has literally launched 550,000 tests, and yet they only see an 8% positive rate. While when you look at New York, 35% are still testing positive with that many tests. And when you look at New Jersey, it's 49% in New Jersey that are still testing positive. California is at 8%. Florida and Texas are both at 9% with almost 300,000 tests. So you can see, again, it's a very different discussion with different parts of the country. And that is why you're going to see this graduated opening, and what you're seeing right now, a staggered approach on what we see state by state. Total COVID tests, as you can see, the United States at their 5.5 million are doing much more than anyone in the world. When you do tests per thousand, and this is by population now, we only trail Italy, but we are well ahead of South Korea. And we've heard often about South Korea being the model of they tested, and that's why they were able to control the virus. When you look at daily tests, again, the United States providing more daily tests than anyone in the world. We're between 250 and 300,000 tests a day. The goal is to get this up to almost 500,000, which is very doable, and you'll probably see that in the next couple of weeks. The other point when we're looking at how we are on the curve, you're looking at New York is finally starting to see this decline in hospitalizations. Less hospitalizations means less severe cases, means we're not stretching the hospital systems, and it also means less deaths. So that is an important one. I think it's important for everyone to realize, and this is an understanding specifically for our customers, is the point of sheltering in place, the point of physical distancing and social distancing that we've been doing. It was not to prevent everybody from getting COVID-19, because most of us will. What the purpose of that was to, as they talk about, flattening the curve, which means the curve goes wide instead of going high. It just means that many of us will still get it, but we will get it over a longer period of time. The purpose of all of this was to make sure we weren't flooding the hospital system. The purpose was to make sure that the medical system could actually handle it. And what we've done is flatten the curve. When you look at hospitalizations and you look at hospitalizations per age, overall, this is the overall hospitalizations, but as a percentage, you can see, you can actually see as we move through this, these two lines at the bottom that are barely registerable are 18 and under. When you get to this yellow line here, these are hospitalizations 50 and under. This next line is 50 to 64, so 65 and under. And then this is over 65, which you can see is the largest percentage, the largest percentage of hospitalizations. So very much as it has been stated, if you are under 50, your chances of this being severe, if you are diagnosed with COVID-19, are much smaller than those over 50. But then there's another piece to the puzzle. when you look at those going into the hospital, and this is from the CDC, the blue represents adults, the green represents kids, and then the purple is pregnancies. But what you can see is that we've heard this often, those entering the hospital with COVID-19 have an underlying medical condition. And you can see hypertension is actually the lead. Then we have obesity, then metabolic disease and cardiovascular. Cardiovascular has been a big player in this as well. And then chronic lung disease. Very, very important to understand that, because some of the fear that has come around the disease has been around not understanding, again, high risk groups for not only being older, but being older with an underlying condition and then having an underlying condition. These are some of the bigger pieces to it. One of the challenges we've had in the US, and it's an even bigger challenge in Europe, is around nursing homes and long-term care facilities. And what you're going to find is that in the US, there's almost 10,000 cases now, or 10,000 deaths that are attributed to nursing homes and to long-term care facilities. And you can see on this chart, the darker the red, the more impactful. And as you can see up here, New York was 3,500 cases. It has been widely reported in New York. One of the mistakes they made is they were sending people that were diagnosed with COVID-19 back to their nursing homes or long-term facilities. That was a mistake in hindsight, because it helped it spread like wildfire in some of these facilities across the way. And when you look at it, full United States, on this chart, the left side, the gray, shows you the number of facilities that have a case in their facilities of COVID-19. And on the right side in red, this is by state, the percentage of their overall deaths related to COVID-19 that are coming from these facilities. As you can see in Minnesota, it's quite large. Iowa was large, Rhode Island was large, but all the way around, even when you get to New York, when you look at a fatality rate that is that high, to have 25% of them coming from the nursing homes, it's a large number. And then when you look at what's going on around the globe, it is the same issue. When you look at mortality rates that are coming from care homes, you can see in Norway and in Canada, I mentioned earlier, this is Canada's issue. It's well over the 50 percentile, and it's been reported that 50% of all deaths in Europe are attributed to the long-term or nursing home facilities. So that's a little bit on the virus. When we look at what's going on economically, not a surprise. We are going to get to 26 million unemployed pretty quickly here. Last week we had another 4.4 million. At least we're on the downtrend. But this number is still quite large, and we'll have another reported number tomorrow. I think the estimation is at about 3.5 million. The one positive is we think we're on the other side of this. Sorry about that. We think we're on the other side of this. As you can see, Google searches for filing for unemployment have started to decline. And that is what you would want to see. So there's an anticipation we're past the peak. Doesn't mean there's not more to come, but we are past the peak of the unemployment. Unemployment compensation is a percentage of civilian workforce. Just like the disease is not universal in every state, neither is the unemployment picture in what states are facing. So when you look at what is going on, the deeper the color, the higher the intensity as far as a percentage of your population that's unemployed. Probably not a surprise when you see a state like Georgia talking about needing to open up and why they're opening up. But you can see across the way, you have a lot of states with double-digit percentages of a percentage of their unemployment that's unemployed. And when you get into the unemployment, then it becomes more complicated. How many weeks can unemployment benefits last by state? And this is why some of the states are literally calling out to the federal government for help. The issue has to do with their uninsurance benefits. And you can see their trust funds, i.e. Texas and California and New York. New York and California can only last 2 weeks. Texas can only last 3, while states like Florida can last 32, and states like Nevada can last 23. So again, a little bit of a different picture depending on where you're sitting across the United States. And then the reason that that picture exists is how solvent is your unemployment trust fund. And you would want this number to be at 1 if you're solvent. So for example, Nevada, very solvent and at 1.52, thus the reason they can actually last 23 weeks. Florida at 1.97, thus the reason they can last at 32 weeks. California at 0.21 means they were already underfunded into their trust fund, and that is why they're struggling. Same with New York, was already underfunded, and thus that's why they're struggling. Benefits, again, and who's applying doesn't look universal as well. You can see that to the left side, these are where new applications are rising. Florida being a piece of that. Georgia, you can see being the largest. And then in areas where it's declining, you can see it's Ohio and Hawaii and Michigan. Those all make a lot of sense. And also in California as well. One of the things we're still going to see is a lot of anxiety in the workforce. And this is a latest Gallup survey that actually shows you that, it's one of the highest numbers we've ever seen, where 25% of the people are worried about losing their job. So definitely creating anxiety in the workforce, and that'll maintain for some time. And that unemployment is not just a US issue, it is global. When you look at what's going on in Europe, specifically in Spain, Italy, France, these are going to be really, really high unemployment numbers. And the unemployment rate as a percentage of population, again, when you look at the US being close to France or Italy, we're much larger in population. So again, a much larger impact when it's all said and done. Job losses across different verticals, probably not a surprise that it's accommodations and food and service. That's us. We're the ones that kind of lead it. But this chart does show you that everybody's impacted. There's nobody left out. All verticals are being impacted by this when it's all said and done. Probably the most important piece of what's going on in the economy has to do with oil. Oil, as far as supply and demand, we have way oversupply of oil and no demand. Nobody is driving a car. You don't have airlines using jet fuel. So you have a ton of oil. And actually the biggest issue they are dealing with today is trying to figure out where do you store it, because we don't have enough capacity because not enough is being used. So this is very problematic. I mentioned this because the price of oil is going down. I know you've probably seen it in your gas prices. That's a real positive, but it's also a negative when we have an economy that 1.5 million jobs is actually driven through the oil industry. So this is an important piece of the puzzle. And you're now seeing that the Gulf of Mexico and the oil that we produce off the Gulf of Mexico, we are going to have a dramatic drop in that, and that is going to be impactful to the U.S. economy. Think about states around the South and Texas, Louisiana, huge impact with that. And when I had that call earlier today with COCAL, which is our Latin American meetings organization, they are very, very literally reliant on oil and pricing. So this is hammering Mexico and their economy. This is hammering Brazil and their economy. Canada relies heavily on oil and oil production. So realize this is having a much larger impact, and it's just another pressure point that each country is having to deal with as far as economic pressures. You'll hear the announcements next week. I think it's important to get the shock out of the way because the number's going to look big, but you'll see almost a 30% first quarter loss in GDP. That is the forecast. That is big, but considering we completely shut down commerce in the U.S., it actually surprisingly could have been a lot bigger. But it's important to know that and not have the shock when you see it, because everything will be compared to worse since we've seen since the Depression. We get that. Very different scenario. Yes, it's accurate that this is as bad as we've seen since the Depression, but the Depression had different reasons we were there. So knowing that we turned off our economy and we can turn it back on, which hopefully will have a little bit of a different onset. The U.S. travel industry, we are looking at losing $500 billion in 2020. You can see how that's broken up, and about $110 billion is going to be attributed to the hotels. But you have food services, retail, and this doesn't even get into other services around production services and such, and what that would look like. The trick for all of this, as far as us getting back to some type of movement, is going to come down to the airlines. And this is a worldwide commercial flight tracker. As you can see, we do see a 7-day moving average and then the daily. What we can see is daily, we're starting to see an uptick. And that's as we start getting more news of people being able to travel. So hopefully we will start to see a little more of this, something we're going to continue to monitor. Because we need to see an uptick of this to really get travel starting to move again. Speaking of the airlines, they are all very cash-heavy businesses, and they have been struggling just as all the hotels have. There was a federal payroll assistance that was worked out with the Treasury last week, and as you can see, all of the airlines are participating in, American, Delta, and United participating in the largest degree. And you can see the red is a direct grant, and then there are other pieces of this that are low interest loans to the airline industry. This is going to be continuing to be a conversation for us. And just pulled this out from a latest CBRE report, and you can see that we're finally starting to look at an uptick in positive change week over week, which we had not seen. And this has to do with all travel. And this is a positive for us that we're starting to see a little bit of an uptick as we're starting to get some news on what this could look like moving forward. Everybody's trying to guess on what this is going to look like and how long will it take to recover. And a lot of lines on this chart, but just wanted to show you this very lime green here. That is China. And what we're looking at is China's forecast, as you can see, with them recovering and getting back to almost where they started. In 11 months, which means that should be January of next year for them. When we look at the United States, we were just slightly below that where we started. This is the U.S. Historically before we fell off the cliff. And then we get into a couple of scenarios. So this is the baseline. And this is where we think it will end up getting us close to where we were by second quarter of 2021. But there are a couple of other scenarios. If things really go on the uptick, you can see this is the upside scenario in red, which would have us getting there literally by January of next year. And then we have a downside scenario, and this is if we were to shut down for long periods of time again, what that could look like, and that would be a much, much longer recovery. Most people believe we're somewhere between here and here. Which means it's anywhere between a 10 to 13, 14 month for us to get back to where we were. But knowing how bad it's been, I think all of us would be pleased if we could get back to where we were within a year. We also know about the CARES Act, and some people think that those bills are named because we're caring about the country. It isn't. That's actually an acronym for Coronavirus Aid, Relief, and Economic Security Act. So that is what the CARES Act actually stands for. We had a PPP program in phase one, in the first phase of this that just got replenished this week, but wanted to show you with the percentage of payroll, what percentage of payroll was covered by the loans that were actually executed in the first round. And you can see the state by state. Nevada was lacking at 42%. California was lacking at 38%. The West Coast, candidly, was lacking much more than the center of the country and the East Coast. And you can see that. I'm not sure if it has to do with the banks, how they submitted, what that looks like, but it is interesting that the West Coast was a little bit of a slower PPP response than other parts of the country. And again, this has just been replenished as of this week. There's another 480 billion, as you can see. Of the 480 billion, 60 billion is set aside for small financial institutions. And then you see 75 billion for hospitals and 25 billion for testing and contact tracing. So all of this is in play now. It was signed into law, so you will see this actually come out for more discussion very quickly. The other thing you're going to hear a large discussion about is, our federal deficit and what this is doing to the debt. You can see the Treasury is definitely throwing a lot at the problem in the short term, thinking that this is very much a short-term problem. You can see the anticipation is we're gonna go deeper than any time we have, except for right after World War II. But the forecast is that we're going to bounce back very quickly because, again, this is intentional, and a lot of what the Treasury has set up as far as funding facilities are loans or areas where they will get their money back. So a little bit of a different scenario. And then when we're talking about the debt, you're going to hear a lot of conversation about the debt. Realize the debt is not as important as a percentage to our overall gross domestic product, which we all know is getting larger, and we're getting close to 100%. But most importantly, we've never had interest rates this low. And the important part in all of this about the debt is, can you pay debt service? And with interest rates being where they are, debt service is not the issue. The only concern would be if for some reason interest rates started to spike, but nobody has ever seen any indication of that over the last couple of years. When we get to our leisure traveler, we are right here in the understanding phase and realize there is a whole psychology that people go through. And it was a first very fearful stage. Then we get to understanding, and then we get to action. And we're right now in the understanding phase. We're understanding what the virus is and isn't. We're understanding now, and the question is for clarity, what are hotels going to do? What's the travel industry going to do? What are airlines going to do to make sure that we are ready to travel and ready to take care of those that travel with us? A lot of anxiety, and it's not universal. And I think it's important when you look at this, when you look at the blue, there's blue, and then there's kind of a gold down here. The blue is talking about, and these were Pew surveys, and Pew research that shows you people that are, one, feeling lonely, that's the blue, and two, that are feeling a level of distress or stress. And when you look at the blue, the dark blue is more lonely, and this is less lonely, and then no change. And just to point out, it is 35 and younger that are definitely the highest percentage of feeling more lonely at 33%, and then actually a larger percent less lonely as well. But it's an interesting look at this. I look at distress because this is actually stress, and you can see medium, high, and low. And when you look at low distress, the smallest percentage are those under 30, and you can see the largest percentage of those that are feeling low levels of distress are 65 and older. And I find that odd in that those are the highest at-risk populations. But I also think they have a lot of experience, and they've seen a lot over their life, and they know that, this too shall pass, and we will get to the other side of it. Economically, as we get to the other side, one of the things to point out is versus where we were in 2008, middle class, we are actually very, very stable when you look at where the middle class is with currency and where they are sitting. So you're looking at the middle class being in a much better position than we were in 2008. Then we look at reopening, and we're talking about how we reopen commerce. When you look at what's happening with us in the meetings industry, this is the latest survey from North Star Media, and you can see they're doing a whole survey. But just to point out, 75% of planners are going to be looking at putting in best practices, including protocols for attendants who are ill, reducing crowd densities, physical distancing. How are we doing that? Providing signage regarding prevention and control measures, shaking hands, washing hands, etc. There's going to be a lot of that going on. And then providing hand sanitizer on site for staff and attendees. That is going to be an expectation of everybody as we start to move back into the hotels. One of the positive signs for the last part of 2020 is when you look at this first part of the survey, talks about for you as a planner, if you're rescheduling a meeting, how many of you are rescheduling meetings? And we're looking at prior to the end of 2020. And you can see prior to September is about 16%. And then to the end, it's 54%. So you literally have 70% of meetings that that these planners are still planning to plan meetings between now and the end of the year. And then when you look at new meetings and events, almost 40% of their meetings are looking at, or 40% of the planners are looking at putting meetings between now and the end of the year. So again, you have 40% of the planners on new meetings and 70% of planners looking at rescheduling meetings. So the message to the hotel world is get ready, because you're going to be really busy towards the end of the year here. And then PCMA has a pulse survey going as well. And the green represents the meeting professional, and the purple represents the supplier. And what you just wanted to see is that, not a surprise, digital events and then hygiene standards and physical environments are what planners are thinking they have to know more about. There are not many planners we're talking to that aren't expecting a hybrid meeting between now and the end of the year. When we talk about opening and we talk about phase 1, phase 2, and phase 3, please know phase 1 is no more than 10 people in strict physical distancing protocols. Candidly, we've been in phase 1 for the last 6 weeks. Phase 2 starts to open up, where Americans can gather in more than in groups of 50 people. Non-essential travel can resume, and now we are looking at moderate physical distancing. What we are trying to do is get an understanding of what is going to be the difference between strict and moderate. We know strict is 6 feet. Moderate, does that mean 3 feet? Does that mean 4 feet? What does that look like? And then when we get to phase 3, you can see basically things resume as normal for the most part. And what I wanted to point out is phase 1, phase 2, phase 3, in each phase, and again, we're all in phase 1 right now, we need to have 14 days where we have stabilized our new case count and hospitalization. It's always trying to make sure that we have capacity in the hospital. So it's not just one or the other. There's multiple gatekeepers here. As we get to phase 2, it is, we were in phase 1, and for 14 days we maintained it. We moved to phase 2. Now, as we move to phase 2, we would be looking at the same thing. Can you maintain that for 14 days? Once you do, you can move to phase 3. One of the things for all the hoteliers, it's important to understand the customers asking for this, and this is a floor chart from, or a capacity chart from one of our hotels with ALHI, and you can see they've already changed their capacity charts to show in this room, for instance, their Sapphire room, for a classroom setting at 6-foot separation, it's 234 that will be capacity. Full capacity of the room is 390. They've done it for theater, they've done it for reception, they've done it for banquets. The planners are also asking, what does that look like from a floor plan standpoint? Be prepared to start to show that. This is 250 people at 1 per 6 foot. That is 6 foot separation, 6 feet here, 6 feet here, and 6 feet here. So we are able to keep strict physical distancing in these environments. And again, as we move forward, when we get to moderate, I think this could move to 2 per 6 foot. But I doubt we will be moving to 3 per 6 foot, at least through the fall. Other good news and other news, not good news, other news with airlines is today JetBlue announced that starting May 4th, that they will be requiring face covers for everybody traveling, and that will be from the check-in, boarding, and exit of flights. So they're the first airline to institute something like that. I'm not sure if all airlines will follow, but that is the first one that was announced today. And I am going to stop there because, of course, there's a lot more to talk about, and happy to take questions. And let me see. Stop the share. And I'm back. How should we do questions? Should I just read through them and answer, or are we moderating? Linda, Zach?
I would just go ahead and read through them, Michael, and I'm sure a lot of people have the same questions, so I'll let you run the
Okay.
Okay.
You're going to make me read? That's complicated. I'm just kidding. Hold on one second. I just got to get through it.
Mike, I can give you some questions if you'd like. I can give you some questions if you'd like.
Awesome. Thank you, Angelique.
Okay. How long do you believe it will take for Nevada to get to phase 3?
That's the $1 million question. The one thing I've said about Nevada with the way Nevada is built, it's complex. It is going to be very, very complex to think about that because Nevada was built for crowds, not for minimizing crowds, at least on the onset. I think in reality, there's an opportunity to get to phase 3 by late June, early July. It just depends on when we start to open. The faster you open, the faster you'll get to phase 3 because you have to get the 14 days in between. But I do think there's an opportunity, and candidly, if you look at Nevada's curve, Nevada has done a great job, very much in line with like California. The important part is when we get back into the buildings, what does that look like, and making sure we don't get a large spike. But I do think, and this is everything I understand so far, is Nevada's going to open up in stages just like everybody else. And I think that's the important part when we talk about opening up. Texas, you probably heard, is opening up businesses. Texas is opening up restaurants and they're opening up retail, but they're opening up this week at 25% capacities. So they're only letting restaurants open up at a quarter of its dining room. And then next week, or within 10 days, they'll get to 50%. And then by the end of May, they look at being at 75%. So it's a gradual increase. I would expect the same to be in all areas, including Las Vegas or in Nevada. I would expect you to open up in phases. And you're going to see certain parts open up and people get comfortable with it. There's a lot to think about. Probably one of the most interesting things that's coming up with clients, they don't want to be in elevators and touch buttons. So how do you accommodate for that? How do you make sure they're comfortable with that? Do you have people manning the elevators? You definitely have to have hand sanitizer at every level. It's at every landing of every elevator landing. It can't just be in the lobby. Those are the type of things that I think are going to have to come about. And it's twofold. I think Nevada can get to that phase. When do the crowds start coming back is a bigger question because that's tied to the airlines. And the airlines have to get flights in. Candidly, my biggest concern is that I think people are going to be more anxious on getting on an airplane than they are staying in a hotel, because there are already people staying in hotels now. But it's getting through, and it's not even the airplane. It's going through the whole process, being in the airport, and it's getting through TSA and now getting on the plane. And I will tell you that airlines have already changed their boarding policy. For instance, Delta will be boarding from the back. First class will no longer board first, they'll board last, because they don't want people walking by other people. And originally when planes are going, there's going to be physical distancing, which means you're going to have every other seat open. Thank God the middle seat will kind of disappear because no one's going to sit in them, at least at the beginning. But that's going to be that physical separation as we get started. And all of those pieces kind of throw it in that I think Nevada can, and I think this is everybody's concern. Okay, Nevada's protected itself. You've been in a bubble, and now people are traveling from other areas that the infection may be larger in their outbreak, and now they've come to Nevada or they've come to California. And does that spark an outbreak? Those are all the questions everybody's dealing with, but I do think you're going to see masks at the beginning, and we've heard that from planners. It doesn't mean there'll be masks in all events, but on the onset, there's going to be masks. And the one message I have for everybody, I keep telling people, stop with the new norm. It's not a new norm, it's a short-term norm. Once we get a vaccine, this is a different game. But until we get a vaccine, and until we get a viral treatment, and until we get rapid testing everywhere, we're going to have to do some things differently to make people feel comfortable. And it's because it's been beat into us so prevalently that this is very dangerous. And I can't stress enough, it's a serious virus. It's a serious pandemic. It's very dangerous to a certain audience, but not dangerous to all. And that's the important part. 97% of people that will get this will have no other impact than they got it. And it felt like any other sickness you have. You won't end up in a hospital with it. And that's where there has to be some bridge of that fear so that we can kind of bridge the gap. I think the psychology of the customer is going to be the hardest thing. We're going to have to get people comfortable. And all surveying, though, let me give you some optimism. All surveying is telling us there's about 70% of the audience that they're ready to go. They're ready to go travel. They're ready to go back to it. And then there's this 30% that are just really anxious. And I don't think there's going to be much we can do to relieve that anxiety until they start getting some FOMO. You know, I really think when they start seeing other people traveling and other people being out and about and people at the airports, and when that becomes the reporting you see every day on TV, I think you'll start to have people turn around just a little bit.
Great. Thanks, Mike. There's another one here. There's talk of a second larger wave. How do you see that impacting the remainder of 2020 and the start of 21?
Yeah, and you know what? Here again is some of the miscommunication. I don't want to say misinformation. What they talked about was a concern of it being worse in the winter, not because a bigger second wave. It's because you could be having a COVID outbreak at the same time as an influenza outbreak during our regular flu season. So what they're talking about this being a bigger push is that, again, will it stretch the hospitals? That was the concern. And I say that because I think it needs to be clarified. And Dr. Fauci tried to clarify it. It's the reason he said it could be worse in the fall is just because you're not going to have it during flu season. We were fortunate that this is actually for the U.S. outside of flu season, because our flu season literally goes October to March. This really picked up at the end of a normal flu cycle. That's why it was the only thing that was being isolated. It could impact 21, but I really do expect by the time we get to fall that we're going to have some antiviral treatments that are working, and we're going to have some ways to attack this. And if you have antivirals before a vaccine, you're going to see some better communication when it's all in there. And I think people will be more comfortable with it. And that'll be an important part, because viral treatments need to come into play. And there is some optimism. And you remember talk about Gilead has a clinical trial in phase 3 right now. The initial information that came out of Chicago was very positive. There's 2,400 other people with a placebo audience that's going global right now. And we'll know that in May. If that works, we will have some treatment that has been very impactful. So out of Chicago, so you know what happened in Chicago, but they didn't have a placebo audience. That's why you can't take it and run with it. There were 125 cases in this hospital where they ran the trial with their drug. 113 of the 125 were severe, which means they were extreme cases in the hospital. And on the drug, they only lost 2 people. And of the severe, 111 had recovery and signs of reduced fever and reduced symptoms within days. And were all released within a minimum of 7 to 8 days. So it was very promising. It's now exposed across the globe. China and the WHO reported about it not working in China. That wasn't a controlled study. China didn't have enough of a population. And again, it's really bad information. So I'm hopeful some of those things are coming along, and realize there are a ton of viral treatments going around. If we have some of that in fall, even if we have an outbreak, it's going to be a much better situation. And I think if we have enough testing by the time we get to fall, you're going to be able to test, contact, trace, and be able to isolate it without having to shut down an entire community. That's the goal. We'll know more in 60 days. That's the issue. I'm trying not to forecast. And the one thing I've shared with my team, you can't be definitive about anything in this scenario right now. Everything is, this is what we know today. Every week we get a little bit smarter about what we know, but anyone trying to tell you definitively what's going to happen or not happen, I think they're missing it completely.
Got it. Here's one. Once they find a vaccine, do you think we can resume business operating at 2 per 6 or 3 per 6?
I would think so. I think once there's a vaccine, you're not going to have people anxious about everything that's going on, and that's going to be a whole different situation. I think some of the other things we're putting in play, candidly, are actually going to be a good thing. And it's a great thing we're telling people to wash their hands. It's not a bad habit to get into. And if we can cut down a flu season, we're actually going to be saving lives every year when we're gathering, and a lot of people are gathering around. I think sanitation units and hand sanitation units and some of the things we do in a food and beverage service, some of that sticking around is actually going to be a good thing, not a negative when it's all done. But I do think we'll get back to some normalcy when we have a vaccine. And I the best example I can give you, SARS was scary for everybody. When we got a vaccine on SARS, nobody was thinking about SARS today. And it doesn't mean that it's not around because the vaccine doesn't get rid of it completely. It just means it limits its effect and you don't have these type of outbreaks. So I do believe that that's around the corner, but that's probably not till, at least spring or summer of next year. We had a planner that joined us. She's with Liberty Financial, and they're doing a lot of work in this space. And she'll tell you from 21 on, they're booking 21 on, and they're booking it as normal. They're not really thinking about much of this. So I think that is probably going to be the case.
Gotcha. Okay, how do we balance promoting the reopening of a safe and secure hotel, for example, with staff in cloth masks, having sanitizer available, without constantly reminding them that there's a virus floating around?
In the short term, I'll take this in two answers. In the short term, you're going to want to remind them. Don't worry about not reminding them. You want them to know that you're in an environment that is focused on it, because look, we can pretend it's going to go away. It's not. It's going to be in the news. We're going to have cases every day. The idea is to treat our customers as educated as they really are. They know what's happening out there. But what I was just talking to another group, and one of the things I was saying is they're going to want to see you cleaning everything all the time. That's what's going to give them comfort. They're going to want to see people wiping down the elevator buttons consistently and wiping and sanitizing areas in main public areas. And think about the meeting space. They're going to want to see the fogging machines during a break that are desanitizing or sanitizing a room. The visual is going to give them comfort, not fear, that we're actually attacking the problem. And I think we're missing it if we're going to try to hide it from them or make them forget about it, because all they got to do is turn on the TV or pick up any paper and it's still going to be reported about. It's not going away. And I do quantify that short term. I don't mean forever, but in the short term, over the next 3 to 4 to 5 months, we want to be very vigilant that they're seeing it. And at the airports, that's important. Everybody's going to want to see it.
We have time for one more?
Sure, one more, Angelique.
Okay. Yesterday on CNBC with Jim Murin with the Task Force for COVID Nevada said that they're looking at partnering with airlines to control the attendees' illness levels and use companies like Clear to assist, checking temperatures of the attendees or guests' arrival at conventions. What are your thoughts on that?
I actually agree completely. The testing of temperatures in that, it's going to be really heavy at airports. And anyone who's ever traveled to Asia, that's not uncommon. If you've ever traveled to Asia, getting through customs, you're getting your temperature taken. That's just the norm. I think that's going to become the norm in our airports. It'll be before security, before TSA. But I think there's going to be some expectation and responsibility of, and we've heard this a lot, of the thermal technology that hotels are going to put in on their front doors. That's going to be an important one too. To be able to know, do you have people entering your building that have a temperature? And then the conversation is, how do we start to prepare for a situation that you have somebody that has a temperature, you now need to isolate them in a room or get them to a doctor. So do you have a wing isolated? Which wing is it? Everybody who goes into that wing needs to have the same issue. If not, you're just putting people that could be sick into the rest of the building. So there's a whole bunch in protocol that we got to think about. But the airlines for sure are going to be a big part of it. And it was announced yesterday, by the way, if you did not see it, is the IAC is launching an APEX group. And it's the Accepted Practices and Exchange group around COVID-19 and protocol. I am co-chairing that with a senior director from Salesforce. And our job, and we're going to move really, really fast, we have to, our job is to coordinate everything that's being done from the airlines, from public transportation, from hotels. How do we organize all that's being done into a central place and then get that out to the PCMAs and the ASAEs and the MPIs of the world to say, let's all communicate consistently so that the consumer isn't confused. And every DMO right now is working with local health officials on what those standards are going to look like. If a consumer is going around and has to think about state by state, this is going to be so different. They're going to lose patience or they're not going to travel. So what we're trying to do is coordinate it and organize it so that everybody understands it so that we can get the right messaging out. But I do think the airlines are going to play a vital, vital part in this, and they have to when it's all said and done.
You are at three. It's time. So, do you want to turn it over to Linda?
Yes.
Yeah.
Thank you so much.
Linda, I was going to say, any of the other questions that we didn't answer, I'm happy to send an email. I can send it to you or Zach, and you can get it out to everybody.
All right, wonderful. We appreciate that, and thank you so much for your time. Looking at the comments, everybody's excited. The information it was wonderful, and hopefully took a lot of that anxiety off some of our younger folks out there, huh?
I hope so. Like I keep telling, I get accused of being Pollyanna every now and then, and yeah. I'm not Pollyanna. I'm realistic. Tomorrow will be a better day, and we will get out of this. We'll get out of it together. It's just been painful, and as I told somebody recently, you know, this too shall pass, but it may pass like a kidney stone, but it's going to pass, and we will get to the other side.
Ouch. Thank you again, Michael, for your time. We appreciate it. Thank you, everybody. LVHA, let's stay Vegas stronger. Take care. Goodbye.
Vegas strong, guys.